The shortage of family doctors is worsening across the province. Shauna Hunt speaks with a GTA physician about the impact this is having on healthcare and the urgent need for solutions.
Numbers are just going to get worse.
The Ontario College of Family Physicians is calling for urgent action to cut red tape and help reduce the administrative burden on primary care. A recent survey found 94% of family doctors are overwhelmed with paperwork taking up 19 hours of their work week, and 65% of respondents said they're preparing to leave the profession or reduce their hours. Dr. Alan Grill is the chief of family medicine at Markham Stouffville Hospital and tells me the numbers are staggering.
And this leads to a lot of burnout. We've seen family physicians leave the profession or retire early. It's not really attracting medical students to want to go into family medicine. And even the new family medicine graduates are choosing not to do office-based care because of all of this burden.
New data shows that nearly 30,000 people in East York region and North Durham region, where Dr. Grill works, do not have a family doctor, including more than 8,000 people who have lost their doctor in the past 2 years. Province-wide, 2.2 million people are without a family doctor, and that number is expected to grow to 3 million, or 1 in 5, by 2025.
If people don't have access to family doctors, what is the impact on healthcare?
So what happens at first is that certain medical conditions don't get diagnosed. So for instance, cancer screening doesn't happen. We can't provide good preventative healthcare like vaccinations against diseases that are preventable if you get your vaccine. And then people start to go to other places that may not be the most appropriate for their healthcare, like the emergency department when it's not an emergency, and that just leads to overcrowding. And, you know, with all of this combined, you end up having people that present in later stages of their medical condition. Therefore, they need more complex treatments that cost the system more money. I mean, this is a publicly funded healthcare system. We're trying to save our scarce resources. So not having a family physician actually has all of these other unintended consequences.
Dr. Grill says the provincial government needs to make this a priority and is calling for things like insurance forms to be standardized, referral systems streamlined, and more funding for office staff. He believes this will help retain and attract family doctors and allow them to take on more patients.
The cost of running an office, the fact that we're all competing with each other so patients have to navigate the system, we can do better. And if we wait and we don't make it a priority now, there's going to be even more patients that don't have access to primary care.
Shauna Hunt, City News.